welcome to that. And for those who don't know me, I'm Michael Williams. I'm the Deputy Commissioner for Operations for the Department of Children and Families. And we have a full day, a full event set up for you, not a full day. So for the next several hours, we will engage you in thinking with us and discussing with us the opportunity that we consider historic that's before us. Just so you know, this summit, the planning of it started some time ago, pre-pandemic, because we knew that time had already been upon us to do what's right for children of Connecticut, and that is to actualize a vision that was put in place back in 2016, where all of you participated in a very lengthy process in helping the state of Connecticut's Department of Children and Families and all state agencies come up with what we think would be the right vision for children's behavioral health for all children in Connecticut. And with that vision created in 2016, we moved to implementation stage, and we've been stuck in implementation for quite some time. And in 2019, we all made that decision to move from vision, from implementation to actualization. And that's what we embarked upon. In order to do that, we knew we needed to gather and convene everybody in summit-like fashion to kind of let everyone know we're hitting the start button for actualization and implementation, and make sure everyone was on board. But a strange thing happened between then and now, which is the pandemic that we all have been experiencing, and it has caused a delay in this moment. But that delay has given us an opportunity to really make sure we checked with everyone about what that vision actually is, and making sure people were still on board with the vision that was created. That is, we're not creating a new vision. The vision has already been created. We checked the box. We checked everyone's interests, made sure all of our partners, our state partners, and everyone was on board, and did a lot more work in getting us to this moment. And now we're here. I personally would like to thank from the Department of Children and Families, Joshonda Gurrier, who's our administrator for clinical and community services, and Tim Marshall, who is our director of mental health services here at the Department of Children and Families. They have done just a phenomenal piece of work in getting us to this point, and really wanted to acknowledge their efforts. I think Tim has already put in the chat that for those of you who are here, if you wouldn't mind, just let us know who you are entering into the chat by way of name and agency that you're with. That would be great for us. So our day today, as we look at our agenda, is one where very soon I'm going to turn this over to our commissioner to come forth and open us up with words of welcomes and setting the stage. After that, we'll have a conversation by those who have been chairing our implementation strategies over the past 4 or 5 years, the tri-chairs, as we call them, from the Connecticut Behavioral Health Plan. Once they're done, then we'll come back and we'll go walk you through the vision that is established, that was established by the Connecticut Behavioral Health Plan, and our points of actualization that we are embarking upon. Then following that, there'll be a robust conversation among all our state agency leaders who are here from the public sector, hearing the vision and have been a part of this journey. A facilitated conversation will occur in regards to what they're doing in their state agencies and how this vision resonates with them, and I think historic amount of integration and partnership that has occurred in Connecticut among state leaders. Once that's over, then there will be further dialogue among those of you who are with us, and then we'll move into a conversation around our next steps. So that's how the morning is going to go. Again, thank you all for being a part of this, and we look forward to the dialogue that's about to occur. So without any further ado, it is my distinct pleasure and privilege and honor to introduce someone whom you all know by way of her passion and her leadership here at the Department of Children and Families that causes all of us great pride to be a part of her team. And that is our Commissioner of the Department of Children and Families, Commissioner Vanessa Durantes.
Well, thank you so much to my right arm in government, to Deputy Commissioner Williams and to his team for pulling this forum together in the midst of a recovery from our pandemic. You know, we are up over 100 participants in this morning's conversation, and I'm really excited to be able to welcome you to the Connecticut Children's Behavioral Health Summit. Long time coming. I know a lot of you have been eager and anxious to kind of continue the work of the behavioral health plan. And today you will hear kind of how we got to here we are today and where we go with you from this point and beyond. I'd like to thank you all for your commitment to children's behavioral health in Connecticut. This is, as Michael described, not just historic, but an opportunity to see public-private partnerships. We see partnerships from across all three branches of government. I'm excited to hear from my sister state agencies who are here today and work really hard advancing children's behavioral health. I also want to recognize members of our legislature and representatives who are here today joining with us. We also know that we have members of oversight committees. You'll hear a little bit later on from Pat Reamer and Beresford Wilson as they think about broader behavioral health initiatives and where the children's initiatives kind of fit in on all of that. You'll also, we're also like to acknowledge the special commitment from folks like Steve Hernandez, who his commission has been actively involved with the Children's Behavioral Health Plan. Glad to see you here today. I know I'm going to get in trouble once I start naming names, but I also want to acknowledge the Office of the Child Advocate, who has been staunch in their commitment to children's behavioral health, particularly over the pandemic, but all along throughout this process. I want to have a special acknowledgement to our committed tri-chairs. You know, Ann Smith, Elizabeth Kanata, and Carl Schissel have worked tirelessly as tri-chairs of this effort for the last several years, and notwithstanding the last 14 months that have just been unprecedented as we all tried to navigate this pandemic. But they, as well as I, are really excited about the components of the Connecticut Children's Behavioral Health Plan that seem to mirror some of the things that we have acknowledged over the years need to be a part of a strong comprehensive system. So you will see in the presentation that they have prepared for you all today how a lot of what has been lifted up over the years as important to making sure that the strength of the Connecticut behavioral health system reflects the needs of Connecticut's children are coming through, and they're coming through loud and clear. I also want to thank our partners in, and make sure I look at my notes here, our provider partners. You know, our provider partners have just been Herculean over the pandemic. You know, they've stood by us in state government. They've, you know, helped families navigate the pandemic. They have been there before, and they will be there in strength after. And I know many of them are joining us today. And
You muted, Commissioner, for some reason.
I have
Okay.
now this weird headphone setup that not only allows for muting one way, but there's also muting another way, like we don't have enough mute buttons to contend with. I want to make sure that you heard me say that I am really appreciative of our provider partners, who I know many of whom are on today, the trade associations who kind of collectively gather their thoughts, but also many of the providers individually who have not only helped navigate families through the pandemic, but are the strength of one of the strongest networks of service delivery in the country, in my opinion. I'm not biased there, but, you know, really recognizing that the providers that we have that deliver the service types and the service models across Connecticut really are comprehensive, and they cover from the lightest touch to the deepest end of children's behavioral health needs. So thank you all, and thank you for your input today and beyond. I also want to thank members of our statewide advisory council and regional advisory councils. We have leadership from both of all of those coalitions on with us today. And I also, of course, want to thank the leadership from DCF, who Michael just acknowledged as we open up, as you all know, as the statutory agency responsible for not just the child protection side of things, but the children's behavioral health side. We appreciate your partnerships as the department kind of carries out this other piece of our mission. At this point in time, we have a unique opportunity as a state to really lift up the wheels that have already been in motion with the Connecticut Children's Behavioral Health Plan. And that is, as the governor has recently put forth, he couldn't be here with us today, but I wanted to lift up what I believe is, transformative. He has put together a very bold plan in response to the pandemic recovery funds that'll be coming into the state. And one of the things that I'm very encouraged by is that the components of that truly reflect much of the effort of the Children's Behavioral Health Plan. Very consistent with what we've been talking about over the last several years, very consistent with what we've heard is needed to have a very strong recovery. If you haven't had an opportunity to take a look at it, please, step through particularly the section related to children's behavioral health. You will see that much of what you will hear today is highlighted in the governor's plan. One of the things that he felt was extremely important was that the vision that he put forth as part of the ARPA recovery funds, that's the American Rescue Plan Act, and you'll hear that acronym quite a bit, is that that plan be transformative. I use that word because he wanted it to be bold, he wanted it to be sustainable, and he wanted it certainly to be equitable. And as our state looks to move towards the recovery of the pandemic, the 5 pillars that he lifted up start with defeating COVID-19, finishing the job in the public health aspects that have strained so many of our families. There's a strong component on investing in our future. There's themes to upgrade the technology infrastructure to make sure that there's the benefits that our families and residents across Connecticut can have access to. He supported the recovery of private providers through this pandemic, and it's outlined in his ARPA recommendations. There's a commitment to criminal justice in and as it relates to COVID-19. He's looking to create a more affordable Connecticut by supporting early childhood needs, by addressing K through 12 and higher education impacts of COVID-19. There is this special influence and impact on mental health across the lifespan that you'll hear a little bit more in detail. There's themes of restoring jobs, rebuilding the economy, and returning to the growth of Connecticut by workforce development needs, and then finally modernizing public health and human services infrastructure, of which we all are a part of. That also includes building up the data systems and modernization for access to the citizens of Connecticut and how we collectively serve them. I also appreciate the parents that are joining us here today, because those with lived experience know best about what the shortcomings are about navigating our system, and they know and have told us very clearly what it is that they need. And you'll hear hopefully from folks today that will be able to support whether or not some of the things and ideas that we have put forward are consistent with the needs that parents have said to us are needed to build up our children's behavioral health system. So the piece of the ARPA recommendations from the governor in his plan look to expand the capacity of pediatric inpatient psychiatric services. We know that there is a crisis brewing amongst our emergency departments related to children who need inpatient beds. The ARPA plan also looks to improve the throughputs to our system, from emergency mobile psych through safely and timely discharges from acute levels of care. A proposal that will lift up specifically an idea related to urgent care centers that have happened in other states. There's also emphasis on an integration of medical and mental health care from pediatric offices and primary care settings. There's also attention to urban trauma and the interventions related to violence and racism that we know a lot of our children are experiencing and impact their mental health. There's attention to workforce development, systems governance, racial justice and equity, and then, of course, as I spoke to before, a common data platform and a patient or at least initiatives to make sure that the user feels a streamlined and digitized approach to getting services rendered in the state of Connecticut. So, all of that speaks to a lot of what you will hear today as we outline the Children's Behavioral Health Plan and design the components of it that will not only get us through pandemic recovery, but will get us to be a stronger Connecticut on the other side of it as we were before. This is not just building us back to what we were, it's building us back stronger, building us back wiser because of what we've learned and what has been illuminated through the system. And it's helping us to clearly define what we collectively believe is what will make Connecticut's children stronger, and from a behavioral and mental health standpoint, as well as from a physical standpoint, to become resilient citizens of this great state. So thank you all for joining us today. I look forward to hearing from you and your comments. And I will just say one bit of housekeeping before we jump in, and that is we have allowed you all to mute and unmute yourselves throughout the course of this morning because we want to hear from you. We want this to be an interactive exchange of ideas and thought partners, reinforcing what you see here today, challenging what you may want to lift up in a different way, but also supporting the work that we all need to do. And in order to do that, we had to be able to have the platform enabled so that we could hear from you. So we would also like your help in really managing the feedback and background noise and managing your own mute button. So if you happen to become unmuted or you unmute to speak during the course of this, can you please remute so we can make sure that we can hear from others clearly throughout the course of our time together today. And with that, I think, am I turning it back to Carl or back to Michael? Who goes next?
Next up will be the members of we keep calling them the tri-chairs, but for those who are not clear with what that means, the Connecticut Children's Behavioral Health Plan, which is called Plan for Children, was developed in 2016 and presented to the legislature, and the legislature approved this plan for children in Connecticut. Once that approval occurred, implementation of this plan was designed again as a strategy before the legislature, and the legislature approved the creation of the implementation team, and then appointments to that implementation team occurred through many from our legislature and from the governor's office. And once that team was in place, it embarked upon the awesome task of implementing that plan. That team, by design, was to have three tri-chairs, and they are Elizabeth Cannata, Ann Smith, Elizabeth representing the private provider community, Ann Smith representing the families from the organization AFCAMP, and then Carl Schissel representing the Hospital Association were the three that were elected as the tri-chairs for the implementation of the plan. And without any further ado, I am going to give it to Elizabeth and to Ann to walk us through this part.
Good morning. I'm Elizabeth Cannata, and my fellow tri-chair Ann Smith and I are going to jog with you through a brief history of the Connecticut Children's Behavioral Health Plan. And my choice of word, jog, will become clear to you, I hope, as we move forward in the presentation. So the origins of the current Children's Behavioral Health Plan stem back to 2013, where in response to the tragedy at Sandy Hook, Public Act 13178 launched the process to develop a new blueprint for the children's behavioral health system in our state. And I say new because back in 1999, there had been a study at that time of the Connecticut Children's Behavioral Health System looking at the public spending on children's behavioral health. And that led to the Governor's Blue Ribbon Commission recommendations in 2000. And those recommendations launched what was referred to as the Kid Care movement. And that movement resulted in significant transformation of the children's behavioral health system from what it was in the 90s. And I would argue that the work that has been underway with the current Children's Behavioral Health Plan really reflects some of the impact of Kid Care. For example, the development of the current plan reflects the value instilled through kid care that families have to be not only an integral part of the services, the behavioral health services that are delivered to children with mental health needs, but families also need to be immediately involved and closely involved in the development and the ongoing evaluation of the system. And in line with that value from kid care, the current plan was developed through extensive feedback from families. There were over 40 listening sessions, bringing together not only providers and other stakeholders, but also hundreds of families and youth to reflect together on what was working in the children's behavioral health system, what was not working, and where there were areas for improvement. Can you move, this is slide 4. You see on the slide, no, if you can go back, thank you. You can see on the slide, you can read the core vision of the current children's behavioral health plan. And later this morning, you're going to hear more about what we want to do in regards of the specific, achieving the specific goals of the plan. I also want to underscore the commissioner sort of ran through the 7 thematic areas that are covered in the plan: system organization, financing, and accountability, an emphasis on health promotion, prevention, and early identification, expanding access to a comprehensive array of services and supports, improving the integration of pediatric primary care and behavioral health, eliminating disparities in access to culturally responsive services, ensuring family and youth engagement, and in identified areas for workforce development. You can move to the next slide. In 2015, the Connecticut legislature had the wisdom to pass Public Act 1527, which established the Connecticut Children's Behavioral Health Plan Implementation Advisory Board. And you can see on the screen the 12 state departments that were specifically identified to participate on the board, along with the other represented voices. And this legislation recognized that to fully achieve the vision of the plan, all of the state agencies that intersect with children's behavioral health and in the lives of children needed to be actively involved in the implementation of the plan and accountable for achieving the vision that the plan sets forth. And over the last 5 years, the annual reports of the advisory board that we submit to the legislature each year in October have really highlighted in a number of enhanced partnerships between the 12 state agencies that have improved behavioral health system through expanding services, through improving points of access. And I'd also draw attention to the work that the advisory board has done to develop specific recommendations and to develop an inventory of screening tools for children's behavioral health that help us, and the goal is to help us promote identification of children's behavioral health needs across the different systems where children are found. But the intention is also to make sure that we're promoting better coordinated efforts in the detection and the communication about children's behavioral health needs. Another accomplishment of the advisory board has been the fiscal analysis that was conducted with contributions from all 12 of these 12 state departments and the resources of Beacon Health Options. And the fiscal mapping project resulted in the development and refinement of a platform and a structure that can really provide us with a more comprehensive and meaningful analysis of spending on children's behavioral health that will be very helpful as we move forward. The annual reports of the advisory board to the legislature have also consistently identified that there's need for better coordination between the different elements of our system. The different work groups, task force, oversight councils, advisory boards, et cetera, that are working on overlapping aspects of the children's behavioral health system, but not necessarily always in an integrated way, and sometimes at cross purposes. And that's really why we're here today. So if you can move to the next slide. And through the fiscal mapping work, we've been able to develop the visual that you see here, which captures a shared conceptualization of the ideal children's behavioral health system. our work has really been moving us forward in the fiscal analysis and understanding and having a more consistent understanding between the different partners of what is prevention and what are universal, targeted, and intensive levels of service as they specifically relate to children's behavioral health. And then the shared recognition that our children's behavioral health system has to be solidly based on a platform where we have the social determinants of health and that families' basic needs are also met. We want to make sure that we have the right services at the right time in our system at the right sort of amount that we need. The work of the fiscal analysis has also helped to highlight some of the, actually in terms of the history in promoting children's mental health, I think it's worth underscoring what the fiscal mapping showed us was actually suggesting some of the gains that we had made since the implementation of the Blue Ribbon Commission's recommendations. Whereas in 2000, the lion's share of public spending for children's behavioral health was for restrictive out-of-home care and only for a very small portion of Connecticut's children in need of behavioral health services. As we looked at spending that was reflected in 2015 and 2016 fiscal analysis, we saw a dramatic evolution of the system to providing services for more children with better services through evidence-based treatments and research-supported interventions that focus on strengthening families and keeping children in their communities, creating less disruption and promoting well-being. So I would also highlight, as the commissioner mentioned, that the work that is reflected in these analyses is really something that often gets attention nationally, that Connecticut really is a leader in terms of developing and maintaining best practices in children's behavioral health and extensive innovation. If you could move to the next slide. Our most recent advisory board report to the legislature, which was submitted in October of 2020, was written in the midst of the COVID-19 pandemic and also in the context of the significant events across the country that really have pressed us towards a more collective sense of urgency towards achieving racial justice and equity. And so the report emphasized the importance now more than ever for there to be better coordination of services and efforts across our system. And as I've reviewed the history of Connecticut's efforts to improve the behavioral health system for children, I hope that the image that fits for you is that we've been running a marathon. And the Connecticut Children's Behavioral Health Plan is the blueprint, the roadmap, if you will, for the race. And we've been gaining momentum. We've been moving towards the end point, but there's substantial ground still to cover. And that's where I'm going to pass the mic to my fellow Tri-Chair Ann Smith to move us further.
Thank you, Dr. Kanata. Thank you, Commissioner Durantes and Deputy Commissioner Williams and the team at DCF. Good morning, everyone. This year, AFCAMP is entering its 20th year as a family-led organization dedicated to empowering families and engaging systems to improve children's lives. Systems plural, because there are multiple systems that touch the children's behavioral health care system. It is in that role that I have served as a tri-chair of the Children's Behavioral Health Plan Implementation Advisory Board. And this morning, I want to speak with you about where we go from here and the next leg of the race. My colleague referenced a marathon. And clearly, with we looking at the Kid Care of 1999 and the Blue Ribbon Commission report, the Children's Behavioral Health Plan, we're at that place where it's our turn to advance that plan. I'm going to have a little bit of a mixed metaphor here, and I think that's only fitting because we are dealing with multiple levels, multiple opportunities, multiple challenges. We're on a lot of different levels. So a marathon is one analogy that works. And where we are now at that next leg of the race, is taking the steps necessary to build on the work that has already been done. This is a time for Connecticut's children's behavioral health system to tackle the challenges and to seize opportunities. When we look to the behavioral health plans reports that were done, we see that progress has been made, and I won't go into as much of that as my colleague has already recounted for you. But we also see that there are challenges that we have identified. Some of those challenges have been met, and there are still hurdles to be overcome. We also see that there are opportunities. There are opportunities before us, some of which we have probably not another opportunity in this lifetime to take advantage of. The next leg of the race is really critical. It's critical because of the needs of our children and families in the face of a pandemic, in the face of community violence, in the face of racial inequity and societal trauma. Now, I want you to understand, it's one race. It's not like we had that race and now we're doing a different one. It's different runners, but it's the same race. The Children's Behavioral Health Plan grew out of a tragedy, and building on that earlier signature work that was done, they seized a defining moment in the state's movement towards a children's behavioral health system that serves all children, affording ease of access and no wrong door. I submit to you that we are at another defining moment. COVID-19, racial inequity, all of the trauma that our children are experiencing, chronic stress, the educational issues, juvenile justice. Connecticut must seize this opportunity to advance the children's behavioral health system. Why? Well, there are many reasons, but what comes to the top and is paramount? Because our children and families require us to do so. This is likely once in a lifetime access to federal, state, and private resources that can be leveraged to support needed innovation and infrastructure. And we have the vision and the blueprint of the Children's Behavioral Health Plan, building on 2 decades of work and what was done in the last 5 to 6 years to guide us in that work. 20 years. Progress? Yes. Nationally, Connecticut is looked at as a leader in children's behavioral health. But we can't rest on our laurels. Our work is too important. Our children are too important. It's not just a marathon. It's also a relay race. Advancing our children's behavioral system, building upon what came before and handing off so that we can make sure that we are passing the baton so that we can move forward. The Children's Behavioral Health Plan is at a key point of inflection. It is a place where we know what works. We've been able to implement some of it. We've been listening to our families. We're listening to our youth. We're listening and we're acting on what we hear. Now that's a heavy lift if you have to do that alone. Luckily for us, I can look across this gallery. You know, when I was writing this, I kept saying, look across the room, but we're not in that room. So I want you to imagine. But we don't have to do it alone. There's no one agency. There's no single solitary action to be taken. We need coordination. We need interagency collaboration. We need authentic family participation at the policy and program decision-making levels, at those tables. As I look at what we have before us today, I see a wealth of talent, skill, passion, and resources. We have what we need to advance the vision. We have the commitment to do that. So yes, it's a heavy lift if you're doing it alone, but we can advance the vision together. And as we go through the rest of today's summit, you'll learn a little bit more about how we are poised to move our children's behavioral health system to the next level of excellence, and how we will be looking to each one of you to help us advancing Connecticut's children's behavioral health system together. Thank you.
So thank you, Dr. Kanata, and thank you, Ann Smith, for your tireless efforts, as mentioned before, and your opening comments related to the work that we are about to engage in right now, and that is walking us through this plan that we have been so excited about and its implementation. As I mentioned earlier in my comments, under Commissioner Durantes' leadership, we met very early on to determine exactly what our work will be in children's behavioral health, being the state agency with the statutory responsibility for children's behavioral health services. We wanted to make a decision that was going to move the system forward and would have the greatest impact on children. And in thinking about what our direction and plan and strategy would be, we took a look at the vision and the plan that was already in place and had to make a decision as to whether or not this plan was good enough for us to move out on, or did we need to go back to the table to do more planning and more visioning or create a different vision, because it's been a while, as you've heard, from the creation of the plan and the implementation process that we've been engaged in, as to may cause some of us to think that the plan may be stale. And so when we looked at critically the plan and had critical conversations with the tri-chairs and other leaders, what we come to recognize and conclude, and hopefully you will too, if you want at your leisure, you can download the plan on plan4children.org. What we concluded is that the plan itself is not perfect, but the plan is really, really good. And in that statement that we've heard so much, do we want the perfect to be the enemy of the good, or does this really good plan as is gives us the opportunity to move from creating a planning process to an implementation process? And so our decision was it does, and therefore we will move out in this administration in actualizing and implementing this vision that's been laid out before us and created by many of you with the hard work and efforts that you put into it. And it is our goal. It was our goal as we started this to say, let's move out, let's go as far and as fast as we can to actualize this plan. And along the way, there is room for continued improvement, tweaks, changes. It's not static, but at least it gives us a start. And then secondly, what we also recognize, as Ann Smith mentioned, is that here in Connecticut, we are gifted by the fact that we have tremendous amount of resources. Yeah, there's still gaps and there are still needs, but when we do a scan across this nation, we are resourced better than most states. And we have a rich legacy of people getting involved, of folks moving the system forward, of people just really rolling up their sleeves and want this to be the best system for the children here in Connecticut. So with that and this great plan, we decided, let's implement this plan. Let's move forward and use what we have here at DCF to actualize and to bring this to life. What I would start by telling you as well is that this is not the DCF Children's Behavioral Health Plan. This is the state of Connecticut's Children's Behavioral Health Plan. And it is one that we are hopeful that all folks in Connecticut own this plan, particularly our partner agencies in the public sector, and those of you in the private sector can see that this is all of our plan. We just happen to be the one who is responsible for convening and assuring that it got done and that it got done well. And so here's the Connecticut's Behavioral Health Plan, and it starts with grounding us in a set of values and principles that we all think are important to do this work successfully in Connecticut. And right off the bat, you can see the first value and principle that is highlighted in this is racial equity and justice. What we do know is that Connecticut does a lot of great things and provide good services, and people are able to be better off from the behavioral health children's behavioral health system that we currently have in Connecticut. But we also know that it's not all people. And when we look at who are left behind and who don't do well in our system that we need to do better with, it clearly shows us by race that there are some inequities around access and some inequities around disparate outcomes. So we want to make sure that as we implement and actualize our plan, that all folks, all children, 0 to 18, 0 to 21 are benefiting equally from the service array that we have in Connecticut, from the tremendous outcomes that we've been producing for many of our children in Connecticut. And they're able to get them when they need it, and particularly developmentally appropriate for when they need it, mainly talking about kids in our juvenile justice system, in our urban communities, where we know, based on the great work in juvenile justice of diverting kids and keeping them in communities, the success to that diversion will be robust and effective behavioral health services for those children who experience trauma. And the second value that we lift up is around family-driven and youth-guided, as you saw from Ann Smith, and you'll hear from Beresford Wilson, that everything we do, families have to be in the front seat and have to share the driving, the steering wheel, and to some extent own it. And children with lived experience, their voice have to be heard loud and clear and integrated into all that we do by way of service delivery. And our system definitely has to be trauma informed. We've come a long way in creating Connecticut making Connecticut a trauma informed state, from education to community-based services in practically every aspect of our work. And so it should not be a surprise to anyone to see that that is one of our primary values for our system here in Connecticut. The children's behavioral health system here has to be culturally and linguistically appropriate. The standards that are set out nationally for how services are delivered to a variety of folks in their natural language and within their cultural context gives us a greater opportunity that people will do better. And the outcomes would be better for folks when they're accessing those services. So assuring culturally and linguistically appropriate services is a value that is a part of our plan. And with the rich diversity that exists in this state, we know that that's something that we all value. It's something that we all embrace. And so that's one of the major pieces of this. The next value to lift up is that it's community-based. For us, it's critically important that when we talk about service delivery, it has to be embedded in the natural communities where people live. And those folks in the community have to feel some sense of ownership of the services that's being provided in their communities so that they can be responsible and can claim accountability for the success of those stories. So those services. So being community-based is important. And then finally, developing a workforce that continues to meet the needs of all folks in Connecticut is the other value of our plan. Investing in making sure we have the smartest folks and we have the best technology in mental health care and substance abuse care is a part of our ongoing work. And as you can see below, that is the vision that is created, that has been created for Connecticut. And give you about 10 seconds to read it. I won't read it to you. Hopefully you've had a chance to see it as I walk you through the values and the principles of our plan. Next slide, please. And so what we have come to see as we moved out on actualizing and implementing are these critical areas in the four quadrants on the screen that need our immediate, urgent, and short-term and long-term investments to assure that the plan not only is successful, but is also sustainable. And first and foremost, we know urgently in the upper left quadrant that we have to begin to deal with the crisis services that's needed in our system and close the gaps that are there, because unless that happens first, a lot of this won't be able to be successful. And so as mentioned already, and you all are painfully experiencing it in our emergency departments, children are there, some due to the impacts of the pandemic, others due to just a shortage in the types of service and care that we don't have in our system based on the urgent need of children and families. And we have to, that's one we have to address immediately. And we'll talk further about how we do that. But we do know as we look at who's stuck in the emergency department, that right now the acuity rates are much higher and beyond what we have historically seen, which means that our treatment interventions have to change to be a little bit more accountable so that children can be served better in their communities. We also know that what we're calling the capacity for special populations need to be enhanced, that children with intellectual disabilities we need to have a system that no longer discriminates against them when they have mental health needs and cause them to constantly be caught in the ping pong of, is it mental health, is it DD? It doesn't matter. It's a child who's in crisis. And when a child is in crisis, rather than trying to determine whose child it is, I think what we're calling for is just come together and everybody own the child and make sure the child gets what they need. But that population, as it continues to increase in our communities, and the challenge of serving children who have intellectual disabilities can continue to go forth. We know we have solutions that can occur if we integrate and coordinate our system better. And then the infrastructure around crisis services definitely will have to change. We'll talk more about that. The fragmented system that exists, we understand and have lived with this for quite some time, that we are, again, rich in services. We have a full array of services, but unfortunately at times those services aren't coordinated well. And a child can be receiving mental health services from 5 different agencies, and none of them know that they're serving that child and that family. And that shouldn't happen in a system like ours. We think we have the opportunity. We can create the structures to assure that if a child gets served by our system, the system itself can integrate and coordinate all of the services that child's receiving, so everyone can have information and be aware of the services and whether or not all the services are needed and working. The upper right is the evidence-based practices, the lack of them at the scale that we need. We have made a determination that we really want to move our system to a system that pays for results rather than a system that pays for activities. And the results and outcomes are the critical piece. And we've heard that from our families, that families no longer are telling us that they want just to go in and get services for their kids. They want to see those services work. You know, they don't want to continue to have to go in and out of the emergency department while their children have been getting services in their communities, and they've invested their time and their energy making appointments after appointments after appointments for 5 weeks, 6 weeks. And then at the end of that period of time, nothing worked. And the kid is, their child is experiencing a crisis. So paying for results is a part of our system that we don't have, that we're changing with this plan. And then the lack of accountability structures, performance management, and again, outcome performance measurement and outcome measurements are the areas of our system that we have to do much better with. And we'll talk about what that much better looks like, so that we are assured, again, through a structure of accountability, that we're getting the best care possible for the amount of investment we're making in our system. Next slide. And so here's a depiction of what the system will look like. The vision that was created, the plan that is put together is narrowed down to this depiction. First and foremost, it's a public and private partnership, and we want to stress that very highly, that we believe that the best way to achieve the outcomes and results that we all want for our children and families, that we have to have a better partnership between the public sector and the private sector in doing this. And that partnership requires us to make sure we are clear of what our roles and responsibilities are in each of our areas, and the overlapping that sometimes occur that creates redundancies and inefficiencies have to be ironed out, so that the appropriate level of care can be given to a child and family whenever they need it. And there's a role for the public sector in that, and we know there's a role for the private sector that are distinct to each of us. And then there's areas in that we have to partner better with to assure that we achieve and accomplish that goal. So the upper right quadrant, part of of the behavioral health plan for children, is to implement in Connecticut a value-based reimbursement system and strategies. Again, talking about earlier, paying for results and outcomes, that has to happen. We can no longer continue to invest in services, invest valuable resources into approaches that don't work. I mean, we can't go to our community and claim that we're providing value when we're not. It's a proposition that we make to, first and foremost, our communities, to say that, you know, your hard-earned taxpaying dollars that have gone into our system has created value for our families, and here's the results by way of the data that we're showing. And so the value-based system is a part of what we are implementing now. All right, so the second part of the plan itself that we are implementing is, and we are actively doing this right now, and I should have led with it first, is trying to address the urgent care needs of our children at this point in time, this real moment in time, trying to reduce the census in our emergency department, trying to assure that children, when they're an inpatient, can get that next level of care, and that the fluidity that we need in our system is there. And we have to do that by doing several strategies at once, because we realize there's no silver bullet, but our plan itself calls for expanded access to acute care services. And what that will require us to do is to expand the capacity for psychiatric care In the inpatient settings, we're working with our partners with the Department of Social Services and the Medicaid agency to find a way to incent our partners to increase the bed capacity in inpatient services. We do recognize that that is a part of the challenge we have in our system, that we don't have enough bed capacity in the inpatient settings. And so to find a way to increase that is what we're working on right now. You can go back up. There you are. Thank you. And we're looking at many different ways with, again, our Medicaid partner to work with our hospitals to bring about more inpatient bed capacity in our system, because we get it when parents have gotten to a point where they feel as though their children are in crisis and no longer safe for them to stay home, and their desires that their children gets care and stabilized to a point where they can come home. We have to meet those parents' needs. We can no longer get into the argument with them and to have them be forced in the decision-making process of whether or not they walk away from their child or be accused of abandoning their children. That's not something that should be a part of our system. Parents want their children to get help. We have to have a system that can respond adequately for the help that parents are seeking for their children. The second part of the urgent care, the urgent approach that we're looking at is to figure out a way when children are ready to be discharged from emergency departments or higher levels of care, acute levels of care, to have them go home safely. Again, when parents are nervous, rightfully so, and anxious about their children coming back home because in their communities they have not connected themselves to the array of services that are appropriate for stabilization at home based on what they feel their needs are. We have to find a way to build a system, a set of services that goes home with those children and their parents, and kind of hold their hands for anywhere from 2 weeks to a month around the stability process to assure that no return or repeat admissions to the emergency department can occur if we can help it, and that children end up doing better, and then a full handoff to other community-based services that are more traditional in nature. But that whole acute level of care that is needed at the time of discharge is a part of what we are promoting, and hopefully can facilitate those services being available very, 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 very soon. And then we are expanding our mobile crisis services to assure that mobility can occur 24 hours a day, rather than stopping at a certain time in the evening and picking back up in the morning, and only telephone consultation can occur. Making that investment in our mobile crisis services is something that we want to immediately do and move towards assuring that when parents are in crises, any time of the day, they get the opportunity to have an intervention in person rather than just by phone. Can you go to the next slide? And then we're looking at more of a medium term, but somewhat urgent, the creation of urgent care centers. And the terminology may change, because when we talk about walk-in urgent care centers, it has the connotation of the medical system and primary care system, where folks can go get their medical care in urgent centers. But the same approach and philosophy that drove the creation of those in primary care, we're trying to bring that to behavioral health care, so that when crisis services are needed, the only option will no longer be an emergency department, but it can be an array of interventions. And this represents one of those, which is a bi-directional crisis stabilization program. And the goal, again, of this is to reduce the amount of time children have to spend in an emergency department or even in an inpatient setting. And we do that by interventions that work and that bring about mental health stability and reduce the crisis in their child's life, child and family's life, so that they can continue to live within their family setting successfully. So this is not replacing emergency departments, but it is another intervention for crisis management for children in our system that we don't have right now. And then somewhat medium term, we want to create in our communities, particularly for our children who are experiencing trauma, and it gets played out in ways where involvement in juvenile justice and delinquency activities become the manifestation of that by their behavior. We see that mostly in a lot of our urban communities, and we're talking about children 12 to 18 years old, children who are Black, children who are Latino, who the system hadn't really served that well. We want to bring about a new set of interventions that along with the evidence-based programs we have in our traditional service array, interventions that we think can go further in reaching those children, that can go further in addressing the trauma brought about by the violence and the racism that those children experience in their communities almost on a daily basis, and integrate that into the clinical care that those children get. And so by creating that network of service and having that be a part of the array of service in Connecticut, we think we'll have a better opportunity to be more inclusive in who's better off with the children's behavioral health system in Connecticut. And so that is one of the areas that we are introducing here in Connecticut for children. And then we already have with our Access program, Access Mental Health program, psychiatric consultation provided to pediatricians across the state through 3 hubs, at Wheeler Clinic being one, and Yale being the other, and Hartford Hospital, IOL, being the third. What we want to do is expand that so that as many pediatricians as we possibly can have full access and robust access to consultation from psychiatrists, because we know the shortage of psychiatry and pediatric psychiatry in Connecticut won't be made up with recruitment and trying to develop workforce fast enough. We have to be able to provide more support to our pediatricians, and this has been shown for us with what we currently have to be effective. We just now want to bring that to further scale so that those families and children can benefit in their medical settings when necessary from a psychiatric intervention. And then we know, again, as we said before, we can't do that without expanding our workforce and making sure our workforce is better prepared to meet the needs. And so we're making investments to develop workforce, not just within children's mental health or DCF, but across all of our systems, because we know we have often experienced a shortage in workforce, which creates the dynamic of folks going from agency to agency, which doesn't help any of us. What we want to do is make sure we have enough capacity in our workforce that all agencies and all of our provider community can rely equally upon without having to experience a shortage of those who are qualified to do the work. You can go to the next slide, please. And then we understand, based on the plan that was put in place and our own internal analysis here at the Department of Children and Families, that there's got to be an infrastructure that supports and sustains this work. And the infrastructure has to be a public and private partnership in order to do that. We see in our sister agency for adult mental health, there is one agency responsible for adult mental health from the time a child enters adulthood until the grave. That state agency is the entity that has the responsibility and has created the infrastructure and has created the design of how those services will flow and how accountability will occur. What we have for our children is an agency, DCF, that has the statutory responsibility, but we don't necessarily have the physical infrastructure in place that will allow our system to continue to be held accountable and to continue to be results oriented. And so it is our plan of implementation to look at ways in which our 12 state agencies that are a part of the legislation can play collectively a governing role of this system. And with our administrative service organization, be able to look at how our system functions by way of performance, by way of financing, and all of that governing bodies do. And then work with our advisory boards and bodies that are currently in place to bring about greater stakeholder involvement through the advisory structure of the behavioral health POC and through the behavioral health plan advisory board. We have so many other boards and activities that are out there. We think it's best for us if we can find a way to consolidate a lot of that energy and activities to assure that good advisory and oversight occurs for the children's behavioral health system so that, again, these items that we have talked about can be achieved. The racial equity and justice, and I've already talked about, so I won't repeat that. Let's go to the next slide. Along with the infrastructure, we believe that there has to be a common data platform that drives how we are performing as a system, and working with the My Connecticut portal, My CT portal that's emerging as the state is moving to more of a data-driven state, to be more of a data-driven state. We think we can leverage that creation that's about to occur to have within children's behavioral health a common data platform for providers and for the public sector so that we are able to share information, obviously with privacy and consent being the staples of that sharing. But we believe that if we can create this data infrastructure that allows us to work together, we'll have a greater opportunity to assuring that the children who are getting care in our system are able to have that care better coordinated, better integrated, and better managed because people have the information that they will need through a system that is created. And so that is the plan, the vision that was put together several years ago, and our desire to now actualize it is what you have just been walked through and described. And what I will do now is end this part of the conversation. I know we've done a lot of talking to you this morning. We want to now have other voices come in and share their thoughts and views of what we have been discussing. And to have that occur, I'm going to have Carl Schissel, who's the other tri-chair of our advisory board, lead that part of discussion and response. So Carl.
Thank you, Commissioner Williams. Okay, everybody, we're going to give you an opportunity to respond and react. And we're going to take a few minutes as you prepare. So there are over, I see 124 participants in this Zoom meeting, and we've allocated 75 minutes for this purpose. So as a matter of physics or even metaphysics, I don't think it's going to be possible to hear from all of you. But this is just one forum, an important forum, and we're very grateful that you're here. But we also know that this is part of an ongoing, decades-long conversation. And so in advance, I'll apologize on behalf of the event organizers that if you don't have an opportunity to be fully heard at today's event, please know that we are available to communicate with you and correspond with you with respect to your interests and concerns. This is intended to be a transparent and inclusive process, and every voice is important. So thank you, and apologies in advance if you don't get the time during today's meeting. So I'm Carl Schissel. I'm the Senior Director of Regulatory Advocacy at the Connecticut Hospital Association. I've been with CHA for about 11 years, but CHA has been around for over 100 years. It's the trade association for Connecticut hospitals, and all Connecticut hospitals belong to CHA. But quick comment about hospitals. As you know, hospitals are no longer that big granite building in the center of most cities. Hospitals are integrated providers of healthcare systems unto themselves, but they're also working more and more in partnership with every other provider of care, plus patients, plus families, and frankly, plus government at every level. So the world has evolved with hospitals, and we are genuinely all in this together. So I'm very pleased and proud to have had the opportunity to serve with Elizabeth and Anne and all the other members of the Children's Behavioral Health Plan Implementation Advisory Board. It's been a genuine privilege. And I'll tell you this, and I think Elizabeth and Anne, you'll appreciate this, when we were recruited to lead among our peers as members of the advisory board, I recall two things from my conversation with then Commissioner Katz. She told me, as was her style, you got no money and you got no staff. But let's figure out a way to build awareness of the need for Connecticut to adopt a systems approach. And it's been gratifying, it's been exhausting, it's been irritating at times, but I have felt a strong sense of partnership and support, not only from the Department of Children and Families, without whom, and I'm referring to all the individuals who've touched us over the years, we wouldn't have made the progress that Elizabeth and Anne described earlier, but also a tribute to every member of that advisory board, and there are over 30. And it's probably among the broadest multifunctional groups that I've seen in my long history of 37 years practicing law in the state of Connecticut and being involved in government. So I hope that as we move forward, we maintain and enhance the transparency of our work, the inclusion of all voices in the development of our work, and frankly, I'll call upon the strength and dedication of every one of you, no matter what organization you represent, even if it's frankly just yourself. We're going to need everyone to realize the common vision. And so thanks for allowing me to pontificate a little bit about my perspective, but I did want to take a moment to thank the department for affording me this privilege of working with my co-chairs with the advisory board, with the department, and with all the state agencies. So yeah, I'm the hospital guy, but I'm not going to spend all my time talking about hospitals. In fact, I'm not going to spend much time talking because this is about you. And by the way, as we open up the discussion portion of the program, I did want to put the agency partners on notice. We've heard from DCF. Among those other 11 state agencies, I did want to focus first on some of our agency partners and perhaps give them an opportunity to offer their perspectives. And so among those agencies, in addition to DCF, the Department of Developmental Services, Department of Social Services, Department of Public Health, DEMAS, as Commissioner Williams mentioned, the Connecticut Insurance Department, the State Department of Education, the Office of Early Childhood, the Office of the Child Advocate, the Office of the Healthcare Advocate, the Judicial Branch, Court Support Services Division, All three branches are represented here today, which is an important feature of the children's behavioral health system. And then finally, the Commission on Women, Children, and Seniors. So if there are individuals representing those agencies who are interested in speaking, we'd love to give you an opportunity to do so. So statistically speaking, and as I said, I know this is not all about hospitals, and frankly, very little of it should be about hospitals, but I did want to give you a statistic from calendar year or fiscal year 2020. In 2020, there were nearly 32,000 hospital visits for behavioral health among children. During that same period, patient visits on what we call outpatient observation status, and that's a status that is not inpatient admission, but it allows a physician or caregiver to monitor a child or a young adult's condition in order to determine whether an admission should be made or whether they can return home. Those types of visits increased by almost 300%. And I can assure you that those are dramatic and unanticipated increases in hospital volume. And I'll take a moment to defend the emergency departments because they exist essentially to address emergent medical conditions. You go to the emergency department because there's an emergency and you need that emergency attended to and stabilized. And that still occurs in every emergency department in the state of Connecticut. But the real question is, what happens next? And all our speakers have sort of alluded to that, to the need to address gaps in the continuum of care. And I think that's where our system work, needs to be so important. So I like to use the phrase, all Connecticut families, children, adults, everyone, should be entitled to the right care at the right place at the right time. And if you need, for example, an emergency department to attend to an emergent medical condition, it'll be there 24/7. But not every emergency necessarily merits a visit to the ED. And so there are some concepts we're exploring, as Commissioner Williams mentioned, the urgent care centers. We, in the hospital parlance, refer to that type of facility as a community-based psychiatric assessment center. So we're going to figure out what to call it. But essentially, it needs to be a place with the capacity to evaluate and stabilize a patient in a behavioral health crisis. And then, of course, get that patient placed into the proper setting if necessary, or returned home with the proper supports to ensure that the patient doesn't fall back into crisis. And so I'm very excited about this moment in time, and I'm looking forward to our evolution in every way as we consider the implementation of a genuine children's behavioral health system. And so thank you again for the opportunity to speak and to facilitate this group. So I wanted to offer an invitation to some of our agency partners. If there is an individual from the Department of Social Services, let's start with DSS, who'd be interested in making a comment, we'd be happy to open up the floor for purposes of your comment. Anyone from DSS?
Good morning, Carl. This is Bill Halsey from the Department of Social Services. Good morning, everybody. So first of all, I just want to thank you and thank DCF leadership, Commissioner and Deputy Commissioner, for their leadership on this. I'm really proud to work along with them on children's behavioral health matters. So we want to walk right alongside DCF and providers and family members to try to evolve the behavioral health service system. Certainly very interested in a value-based reimbursement model for outpatient services. We, as Deputy Commissioner Williams said, we are working hard to advance a state plan amendment related to getting more access to inpatient beds. And also we are working with DCF very closely, even just before this meeting, to try to finalize some work related to some transition work, because we do believe that we do have a crisis in the ED right now, and we're trying to resolve that by gaining some access to inpatient beds, but also help the throughput. So we do know, we have heard from hospitals that there are kids on the inpatient units or in a psychiatric residential treatment facility that are ready to go. And but perhaps there's not a solid discharge plan, or the family's not quite ready for that child to come home. And we want to kind of wrap that family up with some services so that child can be safely discharged from the hospital, and creating some more throughput. So we are ready, and I love the momentum and the enthusiasm shared by this group so far. Ann Smith, you motivated me, so thank you. And we're just ready to help in any way we can to build and improve the system to meet the needs of members and their families.
Thank you, Bill. Very, very much appreciated, and the spirit of partnership, it permeates today's meeting. So I'm going to invite any other representatives from DSS or from the Department of Public Health. And after DPH and the remainder of DSS, we'll put DEMAS on notice in case there's anyone from DEMAS who'd wish to speak. Is there anyone else from DSS? Thank you, Bill. How about DPH, Department of Public Health?
Good morning, Carl. It's Ann Giannette from DPH. Good morning, everyone. Nice to see everyone, and really a very invigorating Monday morning meeting. It is so wonderful to hear about the progress that's being made. And I ditto everything Bill said in regards to the effort and energy on this page. It's just, it is inspiring to hear the words. A little bit about what's happening with DPH. We are keeping a really close eye on possible funding opportunities within our school-based health centers, and also possible school-based mental health clinics that will be established. I will tell you, across our 90 sites that we have in school-based health center, mental health and behavioral health services are still very much moving forward with telehealth and other services, and very much needed. Within the time that we've been in COVID, we've been able to put together a presentation and some efforts, a technical assistance training around adverse childhood experiences with our school-based health center sites, and have asked them to move forward with using tools in that environment. We do feel that school-based health centers are a really great place to be able to engage individuals in behavioral health and mental health services. The need is still there. We're hearing from them, along with our children with the special health care needs providers, our Connecticut Medical Home Initiative statewide, really reaching out and trying to find additional services and supports, both around the areas of mental health, suicide prevention, suicide ideation, that is still out there. And we anticipate that it will be some time where we'll continue to be dealing with this in the community setting, as all of us know. We have some of the most sophisticated care coordinators in our Connecticut Medical Home Initiative group. I really hope that we can continue to engage them. They have excellent family connections. They understand systems and resources in the community. They understand how to make connections to the community. And I think I have Allison on the call as well. She may be able to add some other specific things that are going on within the Connecticut Children's Medical Environment situation, and what's going on around mental health. But we stand ready to partner, always scanning for new grants and opportunities, mental health and children's mental health. Screening for finding people is integrated within our MCH block grant. We have a new 5-year needs assessment that we did and 5-year plan. So we are here interested in being a really helpful partner, want to, carry the lead when you feel that we should be doing that and stepping up and stand ready. So Allison, I don't know if you have anything to share in regards to work.
Thanks, Ann. My name's Allison Matthews-Wilson. I'm the Director for Care Coordination at Connecticut Children's, working closely with our social work team and our care coordinators, excited about the plan. We definitely at Connecticut Children's see care coordination as a very viable support. We've been working with our emergency department, families, for the last 5 years and connecting families who are leaving our emergency departments with behavioral health concerns and providing care coordination supports. We see that as one of many of the avenues that Children's continues to take in focusing in this crisis, and just look forward to partnering with these great agencies on the call and continue to work on this Monday morning to support the needs of all the families we serve. So thank you, Anne.
Thank you,
You're
Allison.
welcome. Yep.
And thank you, Anne.
Sure enough.
And thank you, DPH. So next, we have DEMAS, the Department of Mental Health and Addiction Services, followed by the Department of Developmental Services. And by the way, we are aware that questions are posted on the chat, and we'll do our best to get to those questions and offer you some additional information. We appreciate all the avenues for virtual communication, although I'd much prefer to be in a big room with you all. But here we are. So DEMAS obviously is critical to approaches with respect to systems. And I was wondering if there was anyone from the Department of Mental Health and Addiction Services who'd care to offer remarks about what you've seen and heard so far today.
Hi, good morning. It's Amy Maracino. Hi, I'm the Director of Young Adult Services for DEMAS. Commissioner Delphin-Rittman was on the call this morning and she had to leave for another meeting. But we're very excited about her nomination by President Biden as Assistant Secretary for Mental Health and Substance Use. So she will, I think, continue to be a great resource and advocate in her new role at SAMHSA. So, but we've been so excited to be part of this long journey and collaboration among all the state agencies, among participating in the Children's Behavioral Health Plan, and really enhancing our collaborations between agencies. One of the ways I think we can really help to bridge the gaps is through, we have our memorandum of agreement with DCF, but we've also developed one with Beacon this year to continue the transition of young adults, not only from DCF, but through Beacon. We're also been having discussions with CSSD about also developing an MOA with them. So just to really bridge those gaps and just ensure that all those young adults successfully transition to the adult system, in addition to their community access to services. We've also been partnering with DCF around the Connecticut Stay Strong grant, which is another bridge between the child and adult system of 16 to 24-year-olds to be able to provide them with, it's a healthy transitions grant, so some specialized services to be able to support them around early engagement and interventions. And so we're really excited to continue with the partnership, discussions around, value-based performance and other ideas going forward. So we're excited and happy to be part of this great partnership.
Thank you, Amy. And we'll all miss Commissioner Delphin-Rittman, but watch her with great pleasure and joy as she continues to have a very positive impact on behavioral health, not only in the state of Connecticut, but nationally as well. So maybe Connecticut's loss will be Connecticut's gain ultimately, but we thank her and the entire department for all the great work you've been doing. So all the best to you and the commissioner.
Thank you so much.
So we invited the Department of Developmental Services to speak next. And after that, I'd like to invite a representative from the Judicial Branch, Court Support Services Division, because they are an important provider of services in the children's behavioral health system. Is there anyone from DDS who'd like to take a moment to offer their observations?
Good morning. This is Jordan Sheff, Commissioner at DDS. We're really excited. We've been talking about this project, this launch, and building out comprehensive continuum care opportunities for people with mental health issues, and that from the ground up, this will be designed and be mindful of the needs of people with intellectual disability to be included. And so we're really excited Very often, people with intellectual disability find themselves having to find a parallel path to a holistic approach to their health, and the state and providers have to have redundant systems. The collaboration that we've had with DCF over the build of this and being mindful of a pipeline that would include people with intellectual disability, even if there are off-ramps for specific needs that are tough to address in another system, will be really nice. It provides a roadmap for the parents and the child. It provides a roadmap for the providers and the state agencies and the state agency staff to work collaboratively with the resources that are available in front of them, and developing an individualized, person-centered approach to mental health is exactly what we would be doing if we were doing it alone. It's great to do it with partners who have more expertise in the areas of child development and mental health issues. And so we've actually been at the table with both DEMAS and DCF pretty routinely, even with the pandemic, to discuss these issues and how we collaborate, cooperate. DSS has been there for some of them as well. So it's very exciting. We're looking forward to doing this, and we'll be interested in what are the pieces that we need to fine tune on our end to make this all fit and be as effective as possible. So thank you for the opportunity to weigh in and to participate this fine Monday morning.
Thank you, Commissioner. Great to have you, and your voice is critically important given the mission of your department. So thank you for taking so much time to be with us today. We greatly appreciate it. So the Judicial Branch Court Support Services Division, as I mentioned, is an important component in the system, and we'll look forward to hearing from them. I also would like to invite the Connecticut Insurance Department to comment after CSSD, if possible. Is there anyone on the Zoom or in the Zoom from the Judicial Branch here to speak? Good morning.
Good morning, Carl. My name is Tasha Hunt. I'm the Deputy Director of Juvenile Probation. I'm joined here today by my colleague, Kathy Foley-Gabb, and I'm sure she'll have something to add. You know, we are happy to have a seat at the table. We have partnered with the department and many of the other agencies that you've heard from today, and that, you know, are a part of just this plan. And to hear Ann and to hear Elizabeth talk about just the juvenile justice system as a whole, and the fact that many of our families that we serve, our clients, they're duly involved with both agencies and many of the agencies that are represented here. And I think that this is a wonderful opportunity for us to figure out ways to improve our outcomes with our clients and with the families that we are serving. I was most excited to really look at the values and the principles, you know, that you're really basing this plan on. And for us, you know, when we talk about racial injustice and when we talk about just being trauma informed, and just looking at, you know, how we are meeting our families where they're at in the system and ways to help them exit the system and feel as though that their voice was heard, particularly our youth. That's where we are now. That's the area that we are working on. And so I am hopeful that as a partner in this process, that we can find ways to collaborate and to improve upon, you know, some of the areas that we're looking to enhance. Kathy, is there anything that you'd like to add?
Sure, thanks, Tasha. Good morning, everyone. It's good to be with everyone this morning. You know, I've worked with the plan for a number of years now, and I really look forward to this next leg in the journey together, in our race together. I do think that there's wonderful opportunities for the state and our partnerships together to do better by our children and families. You know, we see a lot of kids who, you know, are in jeopardy of being detained, not because of danger they may present to the community, but sometimes it's a danger that they present to themselves. And that if there's a better way to access services for them when they're in crisis, we'd really be able to keep them out of the juvenile justice system. So, you know, this is a tremendous opportunity for us to continue our work and to really make meaningful progress in that area and make some demonstrable changes for those children and families. And really, it's an opportunity to shrink the disparity in the JJ system that's based on race and ethnicity, and really helping to support families in identifying what resources are available for them, or even for court personnel to help divert some of the children from the system in general. I think that will be efforts that will be well served for all of us, and I think certainly for the children and families that we all support. But I, just really want to say thank you for having the summit today. It's really great opportunity to be together, especially in the middle of the pandemic, that we're not losing sight of these bigger systems issues, and that our work together continues on. So I'm really excited for the next leg of this journey. So thank you.
Thank you. Thank you, Tasha, and thank you, Kathy, and thank you, Judicial Branch. So next, I would like to invite representatives of the Connecticut State Department of Education. That'll be after we hear from the Insurance Department. Is there anyone from the Insurance Department who would like to wish us good morning and offer their perspective? All right.
Good morning, everybody. Sorry, I was having problems with my mute button.
There's Gerard. Thank you. Good morning.
Great to see everybody. Hope to have everybody in person again soon, so I don't have to show everybody my messy office. Been a part of this since the very beginning, and I think it's always been very helpful to meet with so many different areas to spread the word that the Insurance Department is here to help folks with any problems that they have with accessing their behavioral health, mental health, or substance abuse coverage under their health plans. Connecticut has always been a leader in insurance requirements for those coverages as well. And I think finally the federal government is starting to catch up to Connecticut, and that's very helpful because the vast majority of people who have commercial insurance are not under Connecticut requirements, but under federal requirements. But again, just to reiterate to folks that anybody that you run into is having an issue with their commercial insurance from a behavioral health standpoint, forward that on to me at the department. There's no wrong door, if you will. We'll get them in the right hands if we don't have the jurisdiction for the plan. But the regulatory process begins with complaints. When we have those, we dig into them. We don't handle them singularly. We determine whether or not there's other issues going on, larger issues, and we work to take care of those. Some of the biggest things that we've seen over the years recently is we now have the authority to verify network adequacy, which is a big issue for behavioral health for children, substance abuse treatment for children. And we can make sure that the insurance companies have an adequate network. If it's not adequate, then they'd be required to pay in-network cost shares until their network is adequate. That's about it. And again, anybody who knows anybody who's having issues with their commercial insurance, forward them on to us, and that helps us to make sure that the process is working.
And Carl, if I could just jump in for a second here. This is Commissioner Mays from the Insurance Department. Don't have my camera plugged in, and actually when you see me on Monday mornings, you'll know why. But I just want to echo what Gerard said. Now, Gerard has focused on this. This is of particular concern to the department. I'm happy to be here to be able to listen to this over the course of the day and to participate in this. So thank you for the opportunity.
Thank you, Commissioner, and we appreciate very much your presence, and we are also grateful for the partnership we've had on the advisory board with the department since its inception. I think Gerard has been with us every step of the way, and we have felt and relied on the support of your department up to this point, and we'll look forward to continuing that work together. Thank you. Okay, ladies and gentlemen, next we have invited the Connecticut State Department of Education to comment, followed by a representative, one or more, of the Office of Early Childhood, a critically important player. Everyone is important. I'm calling everybody important because everyone is important. CSDE.
Good morning, Carl. This is Glenn Peterson, Division Director at CSDE, and good to see you again. We're working very closely with DSS, DCF, the Behavioral Health Plan Oversight Committee, and boy, I'm going to mess up Beresford's, the committee Beresford chairs, also about behavioral health policy and oversight. In fact, we're working very closely with many of the community providers right now, and we're very, very supportive of this work. In fact, I think we are more involved in this type of work than we ever have been in the past. With a kind of special shout out to Mr. Williams and Mr. Marshall from DCF and Bill Halsey from DSS, as well as other folks on the committee. So we're committed to continue this work and helping make better connections between schools and families and the behavioral health community.
Thank you, Glenn. Appreciate your input, and good morning to you. All right, moving on, we're going to hear from the, thank you, we're going to move on, let's hear from the Office of Early Childhood, followed by the Office of the Child Advocate. Representatives from OEC, the floor is yours.
Hi, good morning, everyone. This is Ashley Mcauliffe. I'm the Family Support Division Director with the Office of Early Childhood. I believe Commissioner Bai had to jump to another meeting, but I will just follow up kind of on what Glenn was talking about. OEC is working really hard with a bunch of our partnering agencies, DCF, DSS, to really focus on behavioral health issues that we see arising through our home visiting services and our birth to 3 services and childcare. So we're really working to implement some changes there and get those services down to the younger children that we provide services to. We all know that they are in need, but there are not a lot of options for those really young ones. So I think this is a great opportunity for all of us here to be at the table working together to ensure that services are provided across the board. And I look forward to all the different things that are going to come out of this work.
Thank you, Ashley. And yeah, I regret, I saw Commissioner Bai in the meeting and was looking forward to hearing from her. I was not aware that she had departed, but thank you so much for ably stepping into the breach and offering the perspective of your office. Thank you, Ashley. This is what we do. We just put people on the spot. It's one of the fun things about being an advisory board tri-chair. We get to do that from time to time. So thank you, OEC, and thank you, Ashley. Next, we'll invite a representative from the Office of the Child Advocate, followed by the Office of the Healthcare Advocate. So OCA, Child Advocate.
Hey, good morning, everyone. Just really appreciate being here. I've been following with a rapt attention a lot of the questions that are being put into the chat, so I'm going to be very brief because I know there's so much to get to, but I think really reflecting on that, I agree with how Michael introduced the day, which is we have enormous opportunity and enormous responsibility to bring our behavioral health system to the next level and build on the strengths that we have. And I think that the questions that folks are putting into the chat really speak to, what are the various strategies we'll use to operationalize that, right? To make the decisions about the dollars, to stretch and reform our governance structure for behavioral health, to ensure that we have a robust, well-connected quality assurance framework that includes the voices of providers, funders, and families. To be able to know that we're making changes that are meaningful, making the most difference for families, making course corrections as needed, lining our dollars and how they're spent across agencies. I think as we've heard from DCF and the other agencies before, the Children's Behavioral Health Plan doesn't live in a vacuum, right? It exists in connection with our early childhood investments, our workforce investments, our state Medicaid plan. So it's that need for an interagency strategic plan to strengthening families and providing a foundation for children's behavioral health is critically important, that our behavioral health plan exists in that framework. Concretely, that we have no wrong door for families. You know, the Office of the Child Advocate rarely gets to hear every day about the successes of our system, though I know there are many. And the families that call our office, you know, to quote my colleague, Mickey Kramer, who's on with us today, the families that call our office have often, most painfully, lost confidence in their ability to parent a child with chronic or complex needs, have experienced difficulties accessing care, have experienced stressors in the community and at school. So breaking down those brick walls in between schools and community providers will be incredibly important going forward, and making sure that the changes we are making are providing the most meaningful difference for families and the experiences that they're having. You know, two statistics I wanted to share that I was thinking about today as folks were presenting is one, I learned this from one of my colleagues, Dr. Danielle Cooper at the Tau Youth Justice Program at UNH, who was giving a talk or facilitating a talk, a community discussion about juvenile justice. And she was talking about the boys in the adult prison system, and who I spent a lot of time working with, around, and on behalf of. But she gave a statistic that I had not known before, which is that based on their research and review, the majority of boys transferred to the adult prison system had been arrested prior to age 12. By age 12, the majority had already been arrested. I think about that statistic because I think it speaks meaningfully to some of the changes that we have to make, starting early, providing those supports early, those connections between schools and communities that have to be made, and who unfortunately is still getting left out of our system of care. I also thought about a statistic that CHDI had in a report from a couple of years ago about emergency rooms and departments, since we started with that today too, which is that according to Medicaid data, just a few years back, approximately 35% of children leaving emergency departments were not connected to community-based care within 30 days of that ED encounter. I think, you know, those statistics tell us we have a lot of work to do connecting people to care when they need it. And I know we can, I know there's tremendous strength in our system that we'll continue to build on. I look forward to hearing more about how we're going to operationalize the vision and investments. My office is here and ready to be part of strategic working groups to look at everything from interagency spending plans to key aspects of our system for which we have vision and infrastructure needs, to looking at the interagency partnerships so that we can operationalize the ease of access for kids, let's say, who have intellectual disabilities, that there's no wrong door for them to access care, and looking at those interagency agreements and how we can operationalize those changes. So with that, I see these great questions in the chat coming up about those alignments. So I will let folks get to that. Thanks very much, Carl.
Thank you, Sarah. Very much appreciate all the work done by your office and by you to help put this event together, but also the work we're going to do together going forward. Thank you for your leadership. So, so we've heard from the Office of Healthcare Advocate. I think next on the list is the Commission on Women, Children, and I'm sorry, I'm misspeaking. I'm looking at my list. The Office of the Healthcare Advocate is next up for speaking purposes, followed by the Commission on Women, Children, and Seniors. And then, ladies and gentlemen, we're going to invite representatives from other agencies who were not called out to offer their perspective as well, recognizing that, you know, while we've been talking about the 12 agencies and all that sort of thing, virtually every agency in some way touches children and families and are equally important to helping us achieve success as a system. And that includes OPM, by the way. So if there are any representatives from the Office of Policy and Management, please prepare yourself, because your support and your leadership from your governor and you will be essential to our success with these interagency systemic approaches. So from the Office of Healthcare Advocate, do we have anyone interested in speaking? And if so,
yes, hello, everybody. My name is Valerie Wizakowski. I'm from the Office of the Healthcare Advocate. Thank you for inviting us. And we have been on this long journey that many of us here have been involved in since the beginning. OHA is excited to work alongside our colleagues to assist our families. I feel that this plan brings hope, and OHA has the ability to work with all insurance plans within or outside of Connecticut and in collaboration with other state agencies and providers. This team concept has helped many of the families that call OHA in need, especially during crisis. And most of the time we're able to assist with our collaboration with our partners and to do so in a timely manner. But there's many times as well that it's not enough. And I just feel that coming together right now with everybody here and to bring this plan along, that we'll really be able to move forward with these families and give them the proper care that they need in a timely manner, and not so much towards the end or when they're so much in crisis, but maybe even before that, so that we can really let these families get the treatment that they need. OHA brings to the table the ability to work with all commercial carriers. Those are carriers inside of Connecticut, outside of Connecticut, any type of insurance plan. We're able to lead appeals for the services denied, as well as navigation of the plan access to in-network providers and or out-of-network providers, whatever the family needs. We want to make sure they get those services, and we can only do this with the help of our collaborative team here. OHA's goal is to provide funding through these commercial plans and to expand funding abilities and save the state money. I just feel that this will be our part of working within this plan, working with all of our colleagues here today. So thank you again for this plan. I just applaud everyone who's worked on this plan. It looks really great.
Thank you. Thank you, Valerie. So one of the reasons you may see, I look surprised when people pop into the screen. I can't see everybody in the meeting, and so I'm hoping as I announce agencies and commissions that someone's there. And so when I see familiar faces, especially those who've been on this journey for so many years with us, it makes me very happy. So apologies. I don't play poker either because I don't have a poker face. But thank you, Valerie, for all the work you've been doing and for the work we'll be doing together. So next, the Commission on Women, Children, and Seniors. Invite someone from that August commission to please take the floor. There he is. Hi, Steve.
Hi, Carl. Thank you. Thank you so much. And thank you so much for this very, very thoughtful presentation. You know, the Commission joined as a partner in this work in a couple of our previous iterations when we were the Commission on Children. And the expansion of our jurisdiction has really continued to match, I think, the way that we have grown as a state in thinking about families and their children, and also the resilience of the state as it relates to families. So I'm really excited about this plan. I'm excited to bring the voice of the legislature and policy and bring this work back to the legislature as well for a couple of reasons. One, treatment always exists in context, and the context is long-term success, it's long-term health, and it's also ensuring that we step in when we need to, but step out when we can and allow families to thrive. So it's really exciting that we're thinking across silo, across branch of government, because that's the only way that we can create a system that is resilient and effective in prevention and in crisis as well. So Carl, I really appreciate what my colleagues have said before this. You know, I look at some of the questions and we think about how are we going to resource this? How are we going to connect resources together? How will we leverage state resources with federal and other funds? And how do we build capacity? Those are all of the things that from the area of policy, we want to continue to help answer all of those questions as we unroll this plan. So thank you, Carl, so much for all that you do.
Thank you, Steve, and appreciate you raising, you know, the issues that you raised. And as we, you know, complete our review of input and comments from our various agency partners, I neglected to invite individuals, you know, from the legislature, both elected state officials. I saw a few at the outset of the meeting. I don't know if they're still with us, recognizing how busy they are these days, and I'm not even sure whether there's a session that may be pulling some of them away, but also representatives of staff working in each of the 4 caucuses. There are policy divisions there. There's great energy and zeal in those settings. And I think one of the ways we've been deficient, and this is as much an indictment of me as anyone else, we sometimes forget, oh, there's that group in the judicial branch. Oh, there's a policy director in that caucus. There is a committee of cognizance in the legislature that touches us. There might be 3 or 4 committees of cognizance who do, and they all need to be part of this process, because without everyone committed to pulling in the same direction, I don't think we have a chance to succeed, and we must succeed. So thank you, Steve. So the guy from the hospitals was audacious enough to call out OPM and other state agencies, but we know OPM has been involved with the planning of this event, and so I'm making it sound a little more provocative than it actually is, but OPM has been a partner in the construction and development of this plan, and Ann and Elizabeth and I know from our early interactions with this administration that our vision is shared by the administration, and this becomes more direct evidence of that commitment. But we did want to take a moment to invite any individual from the Office of Policy and Management, or any individual who is actually a state legislator themselves or here on behalf of a legislator or a caucus, to offer their perspective. Okay, so I'm going to invite representatives from other state agencies or commissions or departments to speak. And while we do that, we're going to take after we do that, we're going to take a moment to recite the questions that have been posted in the chat, or invite those individuals who have posted questions to pose their question themselves instead of having me read it. So anyone else from any other agency or department care to offer input and perspective? So what's interesting to me is every meeting I attend, I usually figure out, oh, there should be someone from this agency or department or group at this meeting. And Sarah Egan mentioned actually, initiatives within the Department of Corrections. And so we know DOC, is an important player in this work as well. And as we construct our future together, making sure that representatives from all the important agencies and departments are part of this is going to be an important aspect of our ongoing work. So moving now to the questions that have been posted in the chat. We're going to do this chronologically, or at least and Tim Marshall or Joshanda will correct me as I go off the rails here, but I do see a question from Tammy Freeberg. Tammy, would you care to take the floor and ask your question, or I'll just simply recite it? I see. Tammy,
hi there. I'm sorry. I was trying to get my steps in while I was participating in the meeting, and I didn't want anyone to see me.
Oh, yeah.
So I actually posted 2 questions. One was really just about this, the slide that identified kind of the gaps and needs. There was one reference to reducing provider burden regarding data and clinically actionable, meaningful data. And I didn't see too much about that in the subsequent slides. So I just wanted to, I hope someone could speak a little bit more to the strategies that were kind of either in place or being put in place to address that.
I'll start it. I'll start it and navigate it if you don't mind, Carl.
Please.
That was the plan.
You bet.
So thanks, Tammy, for the question. Let me just say off the bat that this is the first meeting of this, and definitely not the last. I mean, there's a lot of work that we have to now start as this goes forward. So some of the pieces aren't necessarily filled in yet over some of the things. We know the direction that we want to go, but we don't have all the content in place. the thought leader for us in this area that has been helpful in shaping this has been Tim Marshall and Dr. Jeff Vanderplug from CHDI. And I would definitely invite the two of them to talk more fully about this area of the plan.
So I think one of the things that I would say is that, you know, the details of these kinds of activities are some of the things to be determined, but it does start to get us into the conversation around value-based purchasing and outcome-based care. And so I think, as Bill Halsey mentioned, there are some projects that are kind of in the hopper, if you will, that are moving forward. And I think I saw Alice Forster on also. And I think the Inc. is kind of one of those projects where the requirements related to that kind of have to start to put some parameters around what are you going to really measure to improve outcomes, and then use that as some of your moving forward. So in general, I would make that statement. Additionally, I would just suggest that, so anywhere that we could reduce burden on clinicians, that would be the desire. So one of the challenges I think we've all seen is navigating multiple data platforms and data sources. So that's why one of those big items is trying to figure out, is there a way for us to ease that area also? So I would just make those more generic comments in relation to the question. And I don't know if Jeff had a response also.
No, I would just reaffirm what Michael said, what you just said, that this is more casting vision around this area as opposed to having any detailed concrete planning. Those of you who have participated in performance improvement center related work or have been trained in an evidence-based practice understand the process of data collection being consistently translated into analysis, reporting, and quality improvement activities. And so I imagine that the direction of all of this is just more work along the lines of good implementation science, which many providers have been engaged in with the state for a long time.
Is that helpful, Tammy? Okay.
Thank you, Tammy, and thank you, everyone. So the next questions were posted to the chat by Brunilde Farage. There are a series of questions. Brunilde, would you care to pose your questions, or you leave that to me?
Hi, sure. I'm happy to ask them out loud. So hi, everybody. I'm Brunilde Farage. I'm with the Alliance. We're the statewide nonprofit association, and I work really closely with our children's division, so our community providers that provide kid services. At the Alliance, we work to strengthen community nonprofits and the community provider system. So I have probably dozens of questions, but I will limit it to 3. And I understand that this is, you know, sort of visioning meeting, and there will be operational opportunity to operationalize a lot of the things that we've talked about here today, but just sort of get folks started, you know, to think about that process. I wanted to ask about, you know, the funding for the systems transformation initiatives that were outlined today, the short-term, medium, long-term. It's really, you know, given the history of community nonprofit funding, the inadequate Medicaid rates, the cuts to grants over the years, I'm wondering, you know, what the plan is to increase funding to fully cover the costs of these initiatives. There are some new initiatives on here, but then on top of that, as I mentioned, funding has been sort of inadequate over the past decade or more. And so I'm wondering if you think this is going to be a cost neutral process, or and which areas and initiatives would require increases. And then my second question had to do with the value-based payment system that Tim and Bill from DSS had outlined earlier a little bit, or spoken about. This is a really big change for providers. And in talking with the National Council for Behavioral Health, we have learned how other states have experienced really varying levels of success with value-based payment system in the kids' behavioral health system. And so I'm wondering what are you thinking about implementing in terms of payment arrangements? Will it be some kind of pay for performance or a case rate, or is there going to be any risk, shared risk for providers? There's different types of arrangements, and I think there are consequences to each one depending on the direction that we go. And then my last question had to do with data and data points, and I'm wondering, you know, all of the initiatives that were talked about today, what data was used to, and other variables was used to drive just those types of decisions, especially moving forward into implementing value-based payment and developing the standardized outcomes, and how is that going to be sort of, what were those data points that were considered and how are they going to be shared with folks moving forward? So.
Sure.
Thank you for those courageous questions. Really appreciate it. And thank you for clarifying the pronunciation of your last name. I think I mispronounced it. Brunilda Farai. I appreciate it. Thank you.
Thank you. No problem. Thank you, everybody.
Yes. So I'll take the first and then toss it to Bill and Tim to do the second. And we can jointly talk about the third. But as I stated earlier, today, that I think we all agree that Connecticut is a well-resourced state when it comes to services, and we still have gaps as it relates to the financing of systems and supports for the delivery, fiscal supports for the delivery of our system. I think the very first thing we want to do is wisely assure that our resources are invested appropriately, and that resources go to things that are working, and things that aren't working, we pivot and make a decision about the investment of those resources. I know that may sound a bit intimidating to some, but it's not. It's just being fiscally responsible. The sustainability, the fiscal sustainability of such a plan has to start day one to assure that every dime spent in our system is accounted for by way of outcomes and by way of results. And our role and our job is to make sure that as we learn more about what families and children need, we let that drive our investment decisions through data, obviously showing that what they're saying they need is actually meeting their needs. The beauty of Connecticut is that we have an administrative service organization with Beacon, who has been a very, very good partner to Children's Behavioral Health, and have done a lot of fiscal work with us, doing fiscal analysis, and helped us make some critical decisions about right investments versus investments that may not get us to where we need to go. All that to say, the fiscal conversation for us is got to be framed going forward in Connecticut from a return on investment perspective, because we have to show that the significant investment in Connecticut's system is producing a return, and where we need more investment are the places that represents the gaps. And I think for us, if we can get there together with everybody on board in that frame, I think we have a greater opportunity to show that there is a need for resources to address some of the outstanding burdens, particularly around cost of care, that I know our nonprofit provider community has constantly shared with us that they need. We can do that much better when we have a return on investment framework demonstrating, wise use of the resources we currently have. In regards to how we get there with value-based purchasing and the strategies related to that, Bill has been expert on this and bringing us along with what they've done in the primary care sector in Connecticut and translating that to us. So Bill.
Sure, thank you. So I want to really be clear that this is a journey. This is not something like a switch we flip and turn on value-based reimbursement. That is not how it's going to work. It's going to be multiple phases. It'll be transparent. It may start with, pay for reporting. It will be selecting the right measures to track, but it's an investment in outpatient services. So the theory is that if we make smart investments in outpatient services, ultimately, excuse me, we will save money by reducing the acute utilization. So if we can give outpatient providers the right tools and we select the right measures, we think that they can improve the care of individuals and prevent hospitalizations or reduce the length of stay of hospitalizations and emergency department visits. But I really want to be clear that we don't have this all figured out. This is a journey that we plan to take with providers and show them the process. And there will be probably multiple phases until we get to the final state of a full value-based reimbursement model. So we don't have a set agenda that it has to be a case rate, and we certainly do feel that the providers are not prepared for risk at this time and may not be prepared for risk for a very long time. So I want to just say that out loud as well. So this is a journey that we plan to take with providers, with DCF, with other state agencies, to give them the right tool, the outpatient providers, the right tools, the right incentives, the right metrics, the right feedback on those metrics of how they are doing. And we believe that if we make smart investments in outpatient services, that ultimately the care will improve and the outcomes will improve, and ultimately the costs related to acute care will go down.
Thanks, Bill. This is Tim. I just wanted to add, I just want to acknowledge for the likelihood of the provider community of everything they heard today, that this probably would be the area of highest anxiety, right? It's like impacts payment, and payment reform or change of any kind of system is worrisome and anxiety producing. So we want to just first of all acknowledge that. We also wanted to acknowledge that without this children's behavioral health movement and the invitation you will receive at the end of this for next steps, this is coming to us whether we do it through this work or other work, because the federal government is driving it. We've seen a lot of it coming out of physical health care. So it's a strategy that's starting to be implemented in a variety of required areas. And so this particular opportunity to join us in kind of working out the operationalization of it and the details is an opportunity for you to join us in this public-private partnership to the degree that's possible and that can be most effective. And also just want to appreciate and acknowledge the historic challenges that the state has had with rates and funding levels, and again, appreciate the challenges that the state has put the provider community in at different times over the last number of years. So we want to recognize and acknowledge that what was said, but at the same time, we also want to suggest and say it's an opportunity for us to move forward with you as partners and to improve outcomes to kids and families. Thank you.
And the final part of that equation in response is that not only is it state agency and provider partnership in this, but we got to acknowledge the fact that this has got to be parent driven. Because it's parents of children who determine the value of the services that's going to be delivered. And if they're not equally at the table, or, and I would say, driving what the system should look like, the system will not improve. The system will not produce value. And so for all of our conversations going forward, it's got to have, what's good for children and families and their parents, and not necessarily what's good for the system. That's going to be a tough conversation, but it has to happen. They have to be front and center at the table.
Thank you, Commissioner. I just want to do a time check here. It's 11:22. We're going to, at least by my computer, we're going to end the discussion and response period at 11:25 to allow ourselves sufficient time to continue with the program. That's also a sort of a notice to you, Pat and Beresford, to get ready because your part's coming up soon. On the posted questions, and Steve, I apologize, I do see your hand. Michael Patata had a question. Could you discuss in more detail the initiative for workforce development? Anyone care to comment on Michael's question?
I can just say very quickly that, and if there's anyone from OPM on it, they probably could say it more more concretely than I can, but there's an initiative by the governor's office of creating a full workforce development kind of division that is well-resourced and cuts across all state agencies. And so all of us, all the agencies that had workforce development as a part of their strategies, particularly with ARPA dollars that's going to be invested in the state, all of that has been given over to or encouraged to be partnership with this workforce development arm that's being created within the governor's office. I can't remember the name, the actual title of it, but there is a title with leadership and an infrastructure, and it will be working on overall workforce development for the state of Connecticut.
Thank you, Commissioner. I appreciate that. And one of the things we'll do, if we can't get to your question during this portion, please post it in the chat, and we'll work with you and the entire group to get everyone answers to your questions as one of the next steps moving forward, together. And thank you for your patience and your persistence. I see it's 11:24, and without objections, perhaps if I can surrender the floor back to you, Commissioner Williams, Deputy Commissioner Williams, so you can introduce our next guests.
Yeah, if you can just indulge me to let Steve get his, he has had his hand up, and if you got your last, that'll be the last question, and then of course we'll transition it.
Thank you.
Thank you, Deputy Commissioner. Steve Girelli, I'm among other things, co-chair of the Alliance Children's Division and co-chair of the Behavioral Health Partnership Oversight Council Child and Adolescent Committee. And I applaud the ambitiousness of the plan. One of the things I've been struck with, though, is there are a lot of details about the plan that have not been announced and have yet to be worked out. Can someone speak to what the plan is for the development of the detail of the plan and the timeline and the execution, and who will be doing all of that?
Sure, I can be very quick with you and to say that will be what we segue into when we get to the next steps. What we wanted to make sure we did today was affirm the massive amount of work people have put into developing this plan and developing this vision so that it just didn't sit on the shelf. We owed it to those who put the time and effort in getting this right, and to say this is the right plan. What we brought everyone around the table and that's what we've been doing up until this point in time. We brought everyone around the table just to make sure everyone heard all of us from all the state agencies and all our partners say, we are committed to this plan. Though it may not be perfect, it is the plan that we're all committed to start implementing. The start implementation process begins after today, and Tim Marshall is going to roll that out so that people will see where there's opportunities to participate. It's going to be fully inclusive, transparent, we hope highly participatory, and it should start addressing some of those details, Steve, that I think you're looking for, but we intentionally have not got there yet because we didn't want to get too far ahead of all of you before we start making those decisions. So that's the reason why you didn't see it this morning. Okay. And the question in the chat is a great one to transition. Thank you, Carl, for facilitating that conversation. We got a lot of good information from our partners and from those participating. And now the Behavioral Health Program Oversight Committee is legally established to provide oversight for behavioral health services, and chairing that committee is Beresford Wilson and Pat Reamer. And we will now give the floor to the two of them in whatever order they choose to go.
And I will yield to Pat.
Okay.
Thanks, Beresford. This meeting is really reminiscent for me of the transformation grant that DEMIS undertook in the early 2000s, which required this amount of attention and work and really collaboration with all the state agencies and community providers. So I think this is a very exciting plan. We look forward to being a part of it. Yes, there will be a need for legislative changes to the Behavioral Health Oversight Committee because it really was not established to focus in this way. And so we're going to have to work, I think, with legislators and others to see what that would look like. I will say we're hearing a lot of statistics this morning. I'm literally sitting in Nashville, but I thought this was important enough that I would spend a little less time with my son, who I haven't seen in 2 years, and participate in this. But one of the things I did this morning was reached out. I got a text at about 7 o'clock that we had a child in Hartford Hospital's ED. We don't usually accept children there in our behavioral health unit because CCMC is right across the way. So I quickly checked in with CCMC to learn that they had 30 kids sitting in the ED this morning and that they've had an average of 40 for the last month. So while we have a great plan, we really have to push to ensure that we have the appropriate levels of care. And while none of us want to see kids in hospitals or away from their families or communities, we all know that sometimes that's required. And so I think we really have to look very carefully at where the dollars will go for which levels of care, what can we phase out, what can't we phase out, and what should the system look like as we move to these next steps. So I think the Oversight Council is pleased to be asked to participate more fully. And Beresford or Representative D'Amico, I'll let you comment if you would like.
Thank you, Pat. I agree with everything that my esteemed colleague has just shared. I am also pleased at the collaborative efforts moving forward, and I think that they may, you have heard me say this in the past, have been long overdue. But there's no right time to do the right things every time we have the opportunity. And I think we have to create opportunities to do the right thing. I embrace this initiative. I look forward to working with everyone, pontooning our boats and paddling in the same direction. If we take stock of why we do this work, it is for the benefit of every child in Connecticut, not one particular group of children, not one particular location, but for every child. I anticipate success. I know that's what's going to happen. This initiative helps to break down the mortar of the siloed walls that have been created by racial and social inequities that exist in our history. What I want to know is that, and what I want to see more laid out is that we are not crisis response folks, that we do this because we know that the need is there. And then that way we're not doing it because of these uncertain times or even because of the suspectual data and numbers that we see when we overlay race and ethnicity or geographic area over the data. But we're doing it because we know it's the right thing to do. And it's been a long time coming. So with that, I will yield to our legislative chair, Mike D'Amico, if he is present. If not, then I'll turn that back over to whoever is facilitating this.
Sure. Thanks, Beresford, and thanks, Pat. I just want to offer my congratulations to the folks who worked on this plan and who will continue to work on this plan. You've identified some really important issues, and it's an ambitious plan that obviously is yet to be fully developed, but it's certainly a necessary one. And I look forward, along with everybody, I look forward to the behavioral health system being more effective, less fragmented, which obviously is one of the major goals, and to get better outcomes for the children here in Connecticut. So I will share this initiative with my colleagues. I will keep them apprised of what's going on. Reference was made to the fact that there might be a need for some statutory changes, and I'm certainly happy to try to facilitate that and help with that in any way that I can. I'm always reluctant to say that I'm from the legislature and I'm here to help, because that usually scares people. But I will say that sincerely. Whatever I can do, whatever my colleagues can do in the legislature, in the legislative process to try to help things, certainly willing to try. So congratulations to everyone, and I look forward to all the hard work that comes in the future. Thanks for the opportunity.
Wonderful, wonderful. Thank you. Thank you all from the BHPOC. We definitely look forward to fully integrating all of the voices that are instrumental in making this system better in advisory capacity and governance capacity over the next iteration of this as we implement. We hope that we all will walk closely together to assure that this is done right. Not sure why their screen came up, but okay, to remind me of what the next steps are. But thanks to all of you for that. And let me just say that, you've heard, I think, the words of President Biden when he talks about doing nothing is not an option. Well, in this regards, I just echo those words. If we have gotten substantial investments into our system due to the relief funds that are coming in and our current investment in our system based on the service array and all that, then we can't sit still. This has to get done. And from the Department of Children and Families perspective, our commitment is to make sure we get this done. And so, as I said before, I'll say again, we will go as far as we can, as fast as we can, to implement this plan, and that is our firm commitment. And with that, we hope that you find your place in the implementation process of this, as Tim will begin to walk you through the next steps and where we need you all to be a part of it. So, Tim.
Thank you. So we are in the midst of just establishing a little bit of a mini structure, if you will, that was similar to Family First. And we'd ask you to work with us as we kind of pull the details of what this looks like together. And hopefully you experience, many of you participated in a number of the Family First activities, and you found that satisfactory, because that's what we would like to also continue to do with this. We do have some funding that we haven't yet been able to make available for some staff that would help us to develop a couple of these. But what we'd like to suggest is we develop at least these 3 groups. And as been discussed, is less vision and more operationalizing and implementing, thinking about implementation strategies for these areas. And so we have the value-based purchasing and measurement-based care. We have the data integration, and many of you know that DSS and OPM have a number of those activities, and data integration has been a long conversation in the state of Connecticut and in many state departments. And then finally, kind of operationalizing behavioral health urgent care centers. So we will be communicating back out to you all as these start to get developed and operationalized, and then for first meetings. I would invite you to send me a note to my email address. I was on the distribution list for this, but if you can't find me, it's tim.marshall@ct.gov. And just to indicate which group you may be interested in, and we'll be sure to include you. But we also, you don't need to do that. That's not a necessary step, but invite you to do so if you feel you'd like to kind of weigh in on that. But we will get information out to all of the those who are on the invitation list and those who participated to let you know as those begin to be established and when first meetings are. So that's where we're at, and I'll end there. Thank you, Michael.
Thanks, Tim. Thank you. And so developing the implementation process required us to put together an infrastructure of public and private folks and based on our success we had with putting the Family First plan together. And thank you for those who did participate in that. It's a phenomenal plan that's getting submitted fairly soon. We felt replicating that made the most sense. Not that we're developing a new plan, but we're now moving towards implementation of a plan that's already been developed. We know that it will probably grow to more than 3 groups, which is what happened with Family First. We had started out with a certain number and expanded to like 2 others, 3 others. That's going to happen here. We know that because there are some areas that would have to be a part of this, from fiscal stability and things like that. So if you hadn't saw something you're interested in yet, stay close with us. One will come forth internally. Again, the leadership of that, you'll see Tim Marshall. And Tim, is it Timothy.Marshall or Tim.Marshall?
Tim.Marshall.
Tim.Marshall. And Joshanda Gurrier, joshanda.gurrier@ct.gov, who will be doing that. We have been meeting in an ongoing way just to get us to this point. And now, as we say, the work now begins, because all that we've done up to this point was to get us ready and get everybody prepared to act. And so the summit is a call to action. We hope we've inspired you all to act and to do it within the framework of this plan that has been created that we think gives us a great opportunity to move Connecticut's system forward for children's behavioral health. And with that, I offer these remarks as a wrap up and final and closing statement. Unfortunately, our commissioner is not with us now, and she asked that I would do this for her. And I'm sure if I could channel her, it would be saying thank you so much for this. A staple of her leadership that she's truly committed to is partnership and transparency. And we know partnership doesn't mean agreement all the time. It just means that we were committed to stay at the table and keep talking and stay in partnership with each other to move the whole child welfare system forward. And transparency means we hope we don't get surprised by anything that's being done. We keep the door open, keep the windows open so you can see anytime you want what's happening within the child welfare system. And here's another example of it, dealing with the children's behavioral health services for the state of Connecticut. So we really, really appreciate you giving us these 2 hours and close to 40 minutes on Monday morning, which we know for some of us was really, really tough. When we thought about the day to plan this, we had to take a deep breath and say, let's do it on a Monday morning. But we think it paid off by way of attendance. And again, if you are interested right now in any of that came forth, please let Tim know, but stay tuned very closely to us, and very quickly we will get out information to you to start moving this plan, the implementation of this plan into action. So with that, I will see if the main organizers of this, Tim and Joshanda, if there's anything that haven't been said that needs to be said before we say goodbye.
No, nothing additional from my perspective, but I do want to just mirror the appreciation, and we really appreciate everybody's willingness to participate with us now and in the future. So thank you.
Mm-hmm.